5 out of 1,000 Canadians will be victims of a traumatic brain injury. That is approximately 165,000 people in Canada every year, 456 people every day, or 1 person injured every 3 minutes in Canada. Considering that by 2031, traumatic brain injuries are expected to be among the most common neurological conditions affecting Canadians, it's essential that treatments to aid the recovery of this injury are explored. So what is a traumatic brain injury? Traumatic brain injuries are described as a brain injury that is caused by an outside force. Traumatic brain injuries can be caused by a forceful bump, blow, or jolt to the head or body, or from an object entering the brain. Some types of traumatic brain injuries, or TBIs, can cause temporary or short-term problems with brain function, including problems with how a person thinks, understands, moves, communicates, and acts. More serious TBIs can lead to severe and permanent disability and even death. Common causes of traumatic brain injuries include blows to the head, motor vehicle accidents, falls, whiplash, assaults, and sports injuries, with severity influenced by the nature of the impact. Traumatic brain injuries can interfere with the way the brain normally works. When nerve cells in the brain are damaged, they can no longer send information to each other in the normal way. This causes changes in the person's behaviors and abilities. Moderate to severe TBIs are associated with various cognitive deficits, including problems with memory, attention, processing speed, and executive functioning. In fact, as many as 65% of moderate to severe TBI patients report long-term problems with cognitive functioning. These cognitive impairments often manifest as thinking slowly, speaking slowly, and solving problems slowly, becoming confused easily when normal routines are changed or when things become too noisy or hectic around them, having difficulty switching tasks, speech and language problems, such as having trouble finding the right word or understanding others, and impaired executive functioning, which is a set of cognitive skills that help people plan, focus, and complete tasks by processing information. However, these deficits may not persist forever due to the brain's unique ability to change and adapt in response to experience. This is known as neuroplasticity. Neuroplasticity is defined as the brain's ability to change in response to experience by reorganizing its structure, function, or connections after injuries like TBIs. In other words, the brain is an intricate network of billions of neurons constantly working together to control everything we do, our movement, senses, thoughts, and emotions. Neurons communicate through electrical and chemical signals at connection points called synapses, which look a lot like this. An electrical signal going down the neuron leading to the release of chemicals that tell the next neuron what to do. Zooming out now, this network of neurons are supported by glial cells, which provide critical functions like structural support, nourishment, and repair, ensuring neurons can work effectively. These connections can strengthen or weaken over time, allowing the brain to adapt, learn, and recover. So when the brain faces an injury, it uses these tools to reorganize and heal itself, forming new pathways to restore function. So what mechanisms promote neuroplasticity? One key process is neuronal regeneration, also known as collateral sprouting. When neurons are damaged, nearby healthy neurons can grow new branches called collateral sprouts to replace those lost connections. Another powerful mechanism is functional reorganization. The brain can shift tasks from a damaged area to healthier regions. For example, if the speech center is injured, other parts of the brain may learn to take over that role. Following a traumatic brain injury, in the first 48 hours, neurons die, and some pathways are lost. To compensate, the brain begins using alternative neural networks to maintain essential functions. Over the next few weeks, neuronal regeneration begins. Support cells are recruited to aid in recovery, and damaged pathways transition from being less active to more active. During this phase, the brain's plasticity allows it to form new connections to adapt to the changes. As weeks turn into months, the brain continues its remarkable healing process. New axons sprout, and functional organization begins as the brain reorganizes itself around the damaged areas. Neuronal regeneration and functional reorganization can happen naturally, especially in younger brains, but they can also be enhanced through rehabilitation techniques that encourage the brain to adapt. It's like redistributing work amongst team members when one person is unable to contribute. One promising therapy for promoting neuroplasticity after a traumatic brain injury is engaging in aerobic exercise. A study showed that after participation in a supervised vigorous aerobic exercise training program, individuals with TBI showed significant improvements in cognitive function. These improvements were observed in the domains of processing speed, aspects of executive functioning, as well as overall cognitive function. A reason for this improved cognitive function is due to the release of brain-derived neurotrophic factor, or BDNF, when engaging in aerobic exercise. BDNF supports neuronal regeneration by promoting the growth and survival of neurons. It helps form collateral sprouts, which are those new branches from healthy neurons that replace lost connections after damage. By strengthening these connections, BDNF ensures the new pathways are stable and functional. BDNF is also critical in functional reorganization. It enhances synaptic plasticity, making it easier for the brain to reassign tasks from damaged areas to healthier regions. BDNF essentially primes neurons to learn and adapt more efficiently, especially during rehabilitation. Think of BDNF as a fertilizer for the brain. It nourishes neurons and helps them grow, ensuring the brain can heal, reorganize, and thrive after an injury. That was a lot of information to take in, but here's a quick summary. Traumatic brain injuries lead to cognitive impairments, and there are currently very few treatment options to address these impairments. However, neuroplasticity allows for new connections to form between neurons and reorganizes the brain after traumatic brain injuries. On top of that, we can promote neuroplasticity by engaging in aerobic exercise since it increases BDNF release. This leads to improved cognitive function in TBI patients, helping them regain their memory, executive function, and concentration after an injury.